what exactly that looks like, the dynamics of power and control, the barriers that prevent many people from being able to leave an abusive relationship. And then we're going to talk a little bit about supporting survivors, whether that is individuals that you work with, so patients or clients, or just really anybody that you come in contact with, whether that be neighbors, friends, family, coworkers, and how to respond when someone discloses abuse to you and how to connect them to our resources. Like it was mentioned earlier, please put comments in the chat. And at the end, I'll make sure to give some time that we can answer the questions, just so this is as helpful and informative to you as possible. So I always just like to acknowledge that this topic is hard to talk about. It's not necessarily fun having a guest speaker talk about violence and abuse for an hour. I always just want to recognize that. And also, unfortunately, domestic violence, intimate partner violence, abusive relationships are very prevalent in our society. So we always know, no matter who we're working with, no matter who we're talking with, there could be survivors that we're coming in contact with. And even if this hasn't happened directly to you, you probably know someone. So this is a sensitive topic. So whatever you need to do to take care of yourself this afternoon, whether that is, turning off your camera, stepping out, taking a break, whether that's just ignoring what I have to say for 5 minutes, that's totally fine. We have a toll-free number, a hotline number that anyone can call for support that you'll see throughout the presentation, and that I'll make sure that I put in the chat, just so people have resources for support. Okay. So this is a little bit about A Woman's Place. We are the only domestic violence agency that serves Bucks County. We have been around since 1976, so we're coming up on our 50th anniversary. Our vision, our mission, our values. So we envision a society where domestic violence doesn't exist. We often joke that, we're working to put ourselves out of business. Like, we wish there didn't have to be a domestic violence agency that serves Bucks County. We consider ourselves a community-based social change organization, committed to the empowerment of everybody and committed to ending intimate and domestic violence for everybody. I always like to acknowledge our name can be misleading, because our services are not just for women or people who identify as female. And the issue of domestic violence or abusive relationships, it doesn't just happen to women. It could happen to anybody. Anyone can experience domestic violence. Anyone can be a survivor of any gender, and anyone of any gender can be a perpetrator of abuse. That was the name that was given to us back in 1976. We were started by a group of women in Sellersville that started the organization, and that is the name that we've just always had. There's been some interesting debate about changing our name. The concern is that it can be a barrier for some people in our community who need our services, either don't know that they can come to us or are not comfortable calling a hotline called A Woman's Place, or going to a therapist or a lawyer called A Woman's Place. So there's been some interesting debate about changing our name. I think we're heading in that direction of taking the gender out of it. Either way, regardless of what our name is moving forward, whether we keep A Woman's Place, whether we change it to something else, just so the community knows that our services are for everybody. Oh, my slide's not going to the next slide. There we go. Just so the community knows, our services are for everybody. Like it says there, we recognize anyone can experience domestic violence regardless of race, ethnicity, gender, sexual orientation, ability, age, language, culture, and our services and programs are available to anybody. Really, the only parameter is geography, because we're based on funding. We're the only domestic violence provider. We're funded to serve Bucks County. There are other domestic violence agencies in surrounding areas, like in New Jersey and Philadelphia County and Montgomery County, that we work closely with. So really, it's the only parameter is that you are living in or around Bucks County. We consider ourselves a social change, trauma-informed, empowerment-based, survivor-centered organization. So like, what does that actually mean, like in real practice? Most of our clients have post-traumatic stress. Experiencing domestic violence is one of the most common traumas that people experience. So we are trained in that. We strive to provide services that are trauma-informed, that take into account the whole person's experience. We try to empower our clients to make decisions for themselves. So that we don't tell people what to do. We don't pressure people to make one decision over the other. We don't judge or shame them for the choices that they have made. Our philosophy is to give individuals the options of resources that are available at that time, and then empower them to make the best decision that for them and their families. This is everything that we provide at A Woman's Place. So we're very comprehensive. So we do a lot of different things. All of our services are free, private, and confidential. So it doesn't matter someone's health insurance status. It doesn't matter their income level, because everything is free. So probably our most important service is our 24-hour hotline, which you can see right there, the 1-800-220-8116. So this is 24/7. A real person answers the phone. So it's not like an automated system. You don't leave a message. No one calls you back. You get a real person. And it doesn't have to be, like a crisis or an emergency to call the hotline. You can call with just general questions. You can call for somebody else. We get a lot of hotline calls about that. Somebody worried about someone they work with, a client or patient that they're providing services to, and they're either not quite sure how to help, or that person has asked them to call first and get some information for them. We get a lot of hotline calls about that. And certainly individuals themselves, if they feel like they need our services, they can call the hotline. The gateway to all of our services, the first step is calling the hotline. So that's a very, very important service that we provide. Just checking the chat to see if there's questions. Does the hotline, no, you do not need to live in Pennsylvania in order to call the hotline. That's a great question. So what is great about our hotline is that we have resources and referrals nationwide. So if somebody lives in a different state or a different area, but they need domestic violence services, if they call A Woman's Place hotline, we have those referrals. So I always tell people, when in doubt, call our hotline. Even if you don't think it's a service that we provide, even if you think the person is not eligible for our services, we probably know where to refer people. Great question. Kind of going back to what I was talking about earlier about how our services are for anyone, regardless of gender. I should have mentioned that we do have male clients. We do serve male survivors. We have male staff members. We have male volunteers. We have male board members. So sometimes people are surprised if they call our hotline and a male voice answers. So don't be surprised or alarmed if that happens. That is one of our amazing, staff or volunteers. Or, sometimes people are surprised if they show up to a training and there's a male educator or a support group and there's a male counselor there. We do have men that work for us and that we serve. Our shelter. So our shelter is the one exception to the rule that I just said, because as of right now, our shelter is female only. So only individuals who identify as female and their minor children can live in our shelter. If a man contacted us and needed shelter because of domestic violence, we try hard not to turn people away. So we do have those other referrals. Even if it's not a domestic violence shelter, we have other referrals for housing services and shelter services. We also have special emergency funding to pay for hotel rooms. So if someone contacted us and they couldn't come to our shelter, they weren't eligible, and they had nowhere else to go, and we couldn't find an alternative, we can tap into that funding to pay for a hotel stay. So again, just calling the hotline is the first step. But our shelter is small. It's 7 bedrooms, so we can serve 7 individuals or 7 families at a time. It is located in Bucks County, but we don't give that exact location out just for safety and security reasons. If someone needs the shelter, calling the hotline is the first step. It is often full because it is so small and we serve, all of Bucks County. But sometimes we have, 2 or 3 individuals or families moving out in the same week, and then all of a sudden there's openings. So sometimes there is an opening. When someone is living in our shelter, they have access to all of the services that we provide at a woman's place. We also have a rapid rehousing program that helps our shelter clients find long-term housing. And we help them through the whole process to see if they're eligible, to fill out the paperwork, and kind of like case management to help them through that process. Just checking the chat for any comments or questions. Oh, got ahead of myself. Our next service, comprehensive counseling and therapy. So we have a trauma therapist on site who can provide trauma therapy for our clients. We have one-on-one individual counseling from trained counselors. Our counseling team has a children's advocate to provide additional emotional support to any of our clients who are parents and have minor children. Again, just to kind of help with that parent-child relationship. Our counseling team also runs education programs for our clients, like that empowerment program. These are education programs that focus on understanding trauma and healing from trauma, or from financial development and career development. They also run just general support groups that any of our clients can access, both in person and virtually. Our victim response and legal team, again, comprehensive legal services around the issues of domestic violence. So we have an attorney on staff. She can represent our clients for things like divorce, custody, child support. We have legal advocates that can help our clients through some of the other legal issues that come up around domestic violence, like a protection from abuse order, which is a restraining order in Pennsylvania. So we have a team of legal advocates that can help our clients through that process, the paperwork, explaining the process, going to court with them. And additionally, sometimes our clients are called to testify in criminal court if there was charges brought against their abusive partner. That can be really stressful and traumatizing. So if they choose to, they can have a legal advocate be a support person with them from a woman's place to go through that process with them. That also is the team that works with law enforcement, just to do outreach and education, just so they know that we exist and that they can refer people to us who need our services. Domestic violence is some of the most stressful and difficult cases that law enforcement and dangerous situations that they have to respond to. So just so they know that we are there as a resource for the community. Community education and outreach, that's what I'm a part of. I'm the medical educator. So I primarily work with healthcare providers around the issue of domestic violence. I provide trainings like this and talk about screening for domestic violence in the healthcare setting, how to do that safely, what's the best practices, how to refer clients to us. I go to traditional healthcare settings like hospitals and ERs and doctors' offices. I'm also in places like drug and alcohol rehab, mental health providers, some of those non-traditional settings. Again, just doing education and outreach, or just dropping off our educational materials for their patients and clients and staff members to have that. There's 4 other educators that I work with in our education department. They do a lot of work in the schools throughout Bucks County as a guest speaker. As young as elementary school, they go in and talk about healthy friendships, peaceful conflict resolution. And then middle school and high school, the education programs are more focused on teen dating violence and abusive relationships, and the difference between a healthy relationship and an unhealthy and abusive one, how to get out safely, things like that. But our education team, we will go anywhere and do education programs like this. Workplaces, places of worship, community groups. We do a lot of health fairs and tabling events. So if you have any programs like that in mind that you want us to come out, we would be happy to do that. We also support a pretty big volunteer program through our education department. We have more volunteers than paid staff. Our volunteers are amazing. We could not do this work or run the agency without volunteers. Every department you see listed here relies on volunteers to help run it. You go through a great training, which we have throughout the year. You learn a lot about the issue of domestic violence. You learn about a woman's place, and then you kind of can pick and choose where you want to volunteer. And we take volunteers as young as teenagers and as old as older adults. Our website, which I can give at the end as well, you can go on our website to apply to volunteer or to read more about our volunteer program. And we take a lot of volunteers at our thrift store, which is the last item on the list here. We have a thrift store. It's called In Full Swing. If you like to shop, you must go here. There's bargains, there's dollar racks, there's $5 racks, in addition to what they call a something special section, which is, items that still have the tags on it because stores and community members have donated, brand new items. It's clothing, jewelry, accessories. Anytime you shop at In Full Swing, all of the proceeds are going to all of the programs at A Woman's Place. You also can donate. So you can donate clothing to In Full Swing, shop for new stuff. Anytime you do that, again, you're supporting the whole agency. And what's amazing about our thrift store is our clients get to shop there for free. So any of our clients, including shelter clients, anyone getting services from us, gets access to In Full Swing gift cards, and they can go there and they can shop. They could be totally anonymous if they choose to, and they can get what they need for themselves and their families. In Full Swing is in Doylestown. It's near Doylestown Hospital. We also, in addition to the thrift store, we also have food and toiletry pantries that any of our clients can access for free. So we have offices in Doylestown and Bristol where we house the pantries. So that's things like canned goods, cleaning supplies, toiletries, Pampers and wipes. And again, any of our clients can access those pantries for free. So that is everything we do. Again, free, private, and confidential. And for anybody in Bucks County experiencing domestic violence. Any questions about our services? I can't see the chat, but if there's a question, you can let me know.
Yeah, no questions.
Okay.
Yeah.
Okay, great.
I'll let you know.
Thank you. Great. And you also can hold it off to the end. You write down your questions and ask me at the end. Okay, so this is the definition of domestic violence: a deliberate pattern of abusive behaviors used to gain and maintain power and control in an intimate partner relationship. So I just want to highlight a few terms here. Pattern. So this is not a one-time incident. We're all human. We all make mistakes. We all sometimes do or say things that are unhealthy. That is not what I'm talking about. This is a pattern of abusive behaviors. So abusive behaviors happening over and over again. And the intent is to have power and control over your partner. I want to highlight that term, intimate partner relationship. So this is violence and abuse from someone who perhaps is the most important person in your life, part of your family. And that's what makes domestic violence and intimate partner violence so heartbreaking and so traumatizing, because it is from someone that you probably care about, that you love, who again is part of your life, part of your family. There also can be overlap. So it can be both intimate partner violence and, for example, elder abuse, which I'll talk about today as well, because sometimes the person caring for the elderly individual is their intimate partner. It can be both intimate partner violence and sexual assault if the perpetrator of sexual assault is the intimate partner. It could be both intimate partner violence and human trafficking or sex trafficking, because oftentimes the trafficker is an intimate partner or is someone that the person knows closely. So, we're very aware of those overlaps. We work closely with other organizations like the Area Agency on Aging, which does a lot of work around elder abuse. Also with NOVA, which you might have heard of, Network of Victims Assistance, which is an amazing organization that provides assistance to victims of violent crime, including sexual assault. They have a human trafficking component as well. So we work closely with those agencies because we often are sharing clients and resources with each other. So like I mentioned earlier, the stats are pretty alarming. This is pretty prevalent. So 1 in 2 trans and non-binary people, 1 in 3 women, 1 in 4 men have experienced rape, physical violence, or stalking by an intimate partner at some point in their lifetime. And whenever we see numbers, we always know that this is not telling everyone's story, because many people never share and never disclose that they're experiencing violence and abuse. And this is also only data on those types of abuse. And there's so many different types of abuse that we're going to get into today: emotional abuse, technology, threats, psychological abuse. So sometimes those types of abuse are not always captured in numbers. 1 in 3 teenagers will experience an abusive dating relationship before they graduate high school. So that is all types of abuse, not just physical, and that is both, male and female students. So this is part of the reason why we start our education program so young, because by the time someone gets to high school, 1 in 3 of them will have experienced an abusive dating relationship. So I'm going to ask you this question, and you can put your questions in the chat, or just think about it amongst yourself. Why is it important for social service or healthcare providers to know about domestic violence and to be able to talk about it with the clients and patients that they serve? So I'll give you a few seconds, just thinking about it for yourself. You don't have to share if you don't want to. But if you have an idea or something you want to share, I'm gonna look at the chat for that. To be able to assess for safety and provide resources if needed. Yes. So you have resources. I often think of you as like you're on the front lines. You're working with the community. You're talking to individual people. And you have a lot of information that could be helpful for them, like information about a woman's place that you can share with them. To assess for safety, yes. So as social service providers, wellness providers, healthcare providers, you often are seeing the health effects of domestic violence that maybe no one else in the community and no one else in their life is seeing. So you could be saying it. How to know and identify abuse. Yeah. So how to know, what those warning signs are and how to respond. To open communication. Yes. So the community trusts you, your patients and clients trust you. They know that you are safe. They know that you're there to help them. So they're going to feel comfortable sharing even, sensitive personal information with you, like if they're experiencing domestic violence. And also sometimes a healthcare visit or a conversation with the social service provider is the only time when they're away from their partner who is abusive. So sometimes it's that unique opportunity where they have the privacy and they're able to have those conversations safely. So I would say that you're a very important person. Okay. Abuse can happen to anyone. You're going to get tired of hearing me say that. Seriously, it really can happen to anybody. And abuse is not just physical. Sometimes when people hear the words domestic violence or an abusive relationship, they automatically think of someone being physically harmed. And while that certainly is an example of abuse, it is not the only example of abuse. As you can see here, there's many, many other categories of abuse. And many of our clients that we're serving and that we're talking to have never experienced physical abuse, but they certainly are in danger, and they certainly are experiencing abuse. It just is not necessarily fitting into the category of physical abuse. So abuse can take many forms: verbal, emotional, sexual, physical, financial, social, and spiritual. There's actually some examples missing that I'm going to go into today. So this is the power and control wheel. This might look familiar to you. It's been around for a while. There's different versions of it. It gets updated once in a while. This is on our website. So our website has a resources section. If you click on that, it links you to many helpful resources, including this power and control wheel. If you ever want to, read it further or print it out, copy it, download it, it can be a good visual. Sometimes individuals, many of our clients share with us that for a long, long time, they did not label what was happening to them as being abusive or being violent. It wasn't until they had a visual, like something like this to look at that someone shared with them, that they were then able to kind of, to define, what was happening to them. So it breaks down into different categories and then gives you some more examples under each category. I'm just going to highlight a few things, and then if there's questions, I can dive deeper. People often ask, well, like, how does it start? Like, how do you know if you're in an abusive relationship, or like, what are the first warning signs? The first warning signs usually happen in that exclusion category. Oh, and it also can get missed. Sometimes those first early warning signs can get missed. So it's things like someone who's overly jealous, a partner who's overly jealous, a partner who wants to spend every second of every day with you. Sometimes we call this love bombing. You might have heard that term, where it's like the partner, they want to spend every second with you. They think you're just the best person in the world. They love you so much, like too soon, too fast. They want to know everything about you. But then it kind of delves into controlling behavior, like controlling who you can talk to, who you can spend time with, giving you guilt trips if you have to go to work or have to go to class or have to go to a family event. A lot of isolating you from family and friends. A lot of maybe even spiritual isolation. So like not letting you go practice your spirituality, your place of worship, or pressuring you not to engage in activities and social groups that you once engaged in. That's usually how it starts. And those first early warning signs usually get missed. So I think it's important to kind of just have an awareness of those first early warning signs, because the earlier someone can recognize abusive or unhealthy behavior, the earlier they could possibly leave the situation, and then the safer they'll be. So there is a physical violence category here. So most people realize that someone being physically hurt, like the examples on there, hitting, punching, shaking, using one's body size against another person is abusive. A lot of these kind of fall into the category of emotional or verbal abuse, like name calling, put downs. Emotional abuse could be threats, so threatening to harm themselves, threatening to harm you, threatening to expose private information. That happens a lot. Threatening to expose medical information that's private. Gender identity or sexual orientation identity that is private, threatening to get custody of kids. There's all kinds of threats that can be used. There's a lot of victim blaming that usually goes on with survivors of domestic violence. So their partner will say things like, if you were late, so that's why I had to hit you, or like blaming their abusive behavior on the other person's actions. They'll blame their abusive behavior on anything and everything, blaming it on that they were under the influence of drugs and alcohol, which is not an excuse, blaming it because they had a bad day at work, things like that. We call that victim blaming. There's a whole category of technology, and technology is ever changing, and it's not going away. There's some really positive things about technology in the digital world, but unfortunately, because it's so prevalent and because everyone uses it, it can be used. It can be a power control tactic. So things like demanding that the partner has a tracking app on their phone or their car, demanding that they have like listening devices or cameras in the home, demanding passwords to go through all of their text messages or social media, sharing accounts. So, they only can have a social media account or an email if it's a shared account. And that way, that they have access to everything. So using technology in abusive ways, threatening to expose private information that they have on someone, especially if it's like sexual pictures or videos, using that as a threat. That's actually illegal to post that content without the person's consent, but partners who are abusive will use that as a threat as well. There's a category here: sexual coercion, harassment, or assault. So, there's many examples here, like having sex with someone who didn't give consent or can't give consent. We talk a lot about this issue of consent when we do education programs in the schools. So, consent is asking before acting, communicating, respecting someone's boundaries, respecting someone's right to say no. There's also some other examples in here that sometimes we don't recognize as being abusive. So things like lying and saying you're on a birth control method when you're not to get pregnant on purpose, lying and saying you used a condom when you didn't to cause a pregnancy on purpose, not letting someone have access to reproductive or sexual health care. So like not letting them make their own decisions around pregnancy prevention or safer sex methods. We call that reproductive coercion. There is a whole category missing from this that is very, very common. That is financial or economic abuse. So that could be things like you're not allowed to work, or your partner controls the type of jobs you can apply to or work at because they don't want you to have, certain amount of financial security. Or you work, but your partner controls your paychecks, they control the accounts. They use your money without your consent. They take out loans in your name. They ruin your credit. So this is very common. This is one of the many examples of abuse that often doesn't get labeled as abusive even by the person, because there's no bruises, they're not being physically harmed, but they're certainly being controlled. It also is a very common reason people can't leave, because if you don't have financial independence or resources, you have no options. I'm going to get into some more examples of abuse as we go along, but any questions about the power and control wheel, anything missing, any category you see here that you want me to kind of dive into more? Nope, we're good. Okay. So the cycle of violence. So abusive relationships tend to go in a cycle. So that repeated behavior happening over and over again. Abusive relationships usually don't just stop one day, and they usually don't get better with time. It gets worse with time. We call this the cycle of abuse. So I'm going to start with the honeymoon phase. Every relationship has a honeymoon phase. Even healthy relationships have that honeymoon phase, usually in the beginning, where everything is great, and you're super in love and you want to spend every second with each other and everything is, sunshine and rainbows. And then there's tension. Tension or conflict does not equal abuse. Tension and conflict are normal. Even in healthy relationships, there can be tension and conflict. It's how that tension and conflict gets resolved and gets worked through, whether that's what shows you whether it's healthy or not. So in a healthy relationship, tension and conflict gets processed through things like compromise or communication, healthy communication, or by sometimes deciding that it's not working out and going your separate ways, which can be healthy and normal. In an unhealthy or abusive relationship, every time there's tension and conflict, it ends up with that explosive abusive behavior that we just talked about. The verbal abuse, emotional abuse, financial abuse. It gives you examples there, physical abuse. And then after the abusive behavior, you're back in the honeymoon phase. That's usually when the partner who was abusive will say things like, "I'm so sorry, it'll never happen again." They'll do a lot of, excusing or minimizing or victim blaming. It was the bad job. It was the drug and alcohol problem. Lots of promises that it'll never happen again. And then you're back in that cycle all over again. And what we know is over time, the honeymoon or non-violent phase gets shorter and shorter, and the explosive and abusive behavior becomes more intense and more dangerous. So the longer someone is in this cycle, the more dangerous it becomes and the harder it is to get out. So the earlier someone can kind of break the cycle, the safer it is. There's lots of myths about domestic violence. I went through a lot of them kind of already. But just in general, just to be aware of, domestic violence is not because someone had a bad day or has a stressful job. You know, most of us have bad days. A lot of us have stress at our job, and most of us don't choose to abuse people because of it. It's not necessarily because of a traumatic event in their history or in their past. There's mixed research on this. There is some research that suggests experiencing or witnessing domestic violence as a child makes you more likely to be a perpetrator or a survivor as an adult. But we know many, many people who have experienced a traumatic event in their childhood, like witnessing domestic violence, who as adults are not perpetrators and not survivors. So, we always just want to be aware of that. Domestic violence is not an anger management issue. Actually, quite the contrary. People who are abusive are really good at turning it off and on. They're really good actors and actresses. They're in control. So, they can fool a lot of people. Like a lot of people on the outside have like no idea that this person is being abusive. It's not a mental illness. Actually, it's usually the contrary, that people living with a mental illness or people living with a mental health diagnosis are more vulnerable to experiencing abuse than they are at being perpetrators. So just because someone has a mental illness or is living with a mental health condition does not mean that they're violent. It's not a drug and alcohol issue. I'm going to get into more details about this, but the majority of domestic violence incidences, neither person was under the influence. So using drugs and alcohol is not an excuse for someone to be violent or abusive. And most people who choose to use drugs and alcohol are not violent. So, we always say the only excuse for domestic violence is someone chose to behave in an abusive way. So the only reason for abuse is someone chose it. It's a conscious choice. It's never the victim or survivor's fault. Why don't they just leave? I hear this question all of the time. Why don't they just leave, or why haven't they left yet? Because it can be a process. They say it can take 5 or 6 attempts at leaving an abusive relationship before someone is able to leave for good. So that is normal. It can be a process. They leave and go back and leave and go back, or they say they're going to leave and they don't, which sometimes people on the outside get frustrated or kind of confused about this behavior. But there's many valid reasons why someone can't leave, or they have to go back to their partner who is abusive. Number one, fear. Like when we hear about tragedies, when we hear about someone being seriously harmed or killed by a partner, we know majority of the time they were trying to leave. They had talked about leaving. They had, even just made plans to, file for divorce or to move out. Even just talking about it can increase the risk of serious harm or death. So that's why we never want to pressure anyone to leave an abusive partner. Especially if it's not their choice, that we're all about people making decisions for themselves. So, it has to be their choice to leave. And we also want to make sure that they're doing it safely. We do a lot of safety planning at A Woman's Place, which I'll talk about today, which is like, no matter where you are in the process of leaving, or you can't leave, or maybe you left, but the abuse hasn't stopped, what can you do to keep yourself safe? And no matter where someone is on that process, like many of our clients have not left their abusive partner yet and can't, but they still could get services from us. So, they could call the hotline. They could be meeting with our legal team. They could be going to our support groups. They could be getting counseling and therapy, even if they haven't left yet. Many of our clients left their abusive partner, but the abuse didn't stop. That's typical. That's when we see stalking and threats and harassment continue even after they've left the relationship. Even so, they still can be getting support from us during that. Some of our clients, maybe their abusive situation, was years ago, it ended years ago, they're out of it, but they're just now kind of dealing with and realizing the trauma and the emotional effect it's had on them. And then they can reach out to us to get that, additional emotional support. So no matter where someone is on that timeline, they can come to a woman's place and get services. People don't leave because they feel isolated and they feel they have no support and no resources. So the more that we can kind of raise awareness about this issue, the more that we can tell survivors, they're not alone. There are resources available to them, the more likely they are to be able to leave. We talked about money. Money, children, pets are kind of all tied into one. If you have no financial independence, if you don't have financial resources, you cannot leave. That's why domestic violence shelters and shelters in general and housing resources in general become so important. Sometimes there's an emotional connection that sometimes people on the outside have a hard time with this one. You're like, how could you love someone who's hurting you? They don't love the abuse, but they love that person, the family, the history, and that's real. And sometimes their self-esteem is really low. So the beliefs about themselves because of the emotional abuse that they had makes it very, very difficult. So there's lots of reasons why people can't leave. So we like to reframe the question as, instead of why don't they just leave, which puts all the blame and responsibility on the survivor, to putting the responsibility where it lies. Like, why doesn't that person just stop abusing? There's many health impacts of domestic violence. This probably comes as no surprise to you, that domestic violence has a negative effect on people's health, mind, body, and spirit. Even if they are not being physically abused, even just experiencing those other types of abuse affects their body. Like, the body keeps score, which is the name of a book about experiencing trauma. So we hold on to that trauma. It affects every system of the body. Survivors of domestic violence have higher rates of anxiety, depression, post-traumatic stress, substance use, sleep problems, chronic pain. There's a correlation between brain injury and domestic violence. I'm gonna get to that today. We're learning more and more about the correlation if someone was experiencing physical violence, such as choking, strangulation, gunshot wounds to the head, blunt force trauma to the head. They oftentimes have a brain injury and don't know it. Reproductive coercion. So survivors of domestic violence have higher rates of unplanned pregnancy, sexually transmitted infections, because they don't have control over their reproductive health. And also just struggles across other relationships. So, a hard time getting along with coworkers, emotional detachment, which makes it difficult to get along really with anybody or to communicate with the people in their lives. So it really affects all areas of their life. Domestic violence burdens the healthcare system. The medical cost of domestic violence is $7 billion a year. Survivors of domestic violence use healthcare more, and their healthcare costs are higher. Children who witness abuse are 3 times more likely to use mental health services than children who don't witness abuse. And this is part of the reason why we have our Children's Advocate program. Again, just to offer that additional emotional support to any of our clients who are parents, because this can be a very stressful situation for children. There are certain populations that experience domestic violence either at higher rates or just differently that I would like to highlight. Immigrants is one. So we know immigrants experience higher rates of domestic violence. Their abusive partners will often use their immigration status as part of the abuse, part of the power and control, part of the fear. So threats to have them deported, threatening to call ICE on them, threatening to have children taken away. And oftentimes immigrants will not reach out for services because of this fear. They're afraid to even call law enforcement, even during an emergency. They're afraid to go to the emergency room, even if they have, serious physical injuries. They're sometimes even afraid to call a hotline, like a woman's place. So, we really try to do outreach to this community and to the community in general, just so immigrants know that they can reach out to us, that we provide services to anyone, regardless of immigration status. We do have staff members who are bilingual in English and Spanish, and we do contract with a language line to provide interpreter services including sign language. So hopefully language won't be a barrier to care. Pregnancy is another population that we know experiences higher rates of domestic violence. So oftentimes the abuse starts or it gets worse during pregnancy. Homicide from a partner is a leading cause of death during pregnancy and the postpartum period, and the majority of those involve a firearm. That is one thing that is mentioned on the power and control wheel, the correlation between gun violence and domestic violence. The majority, for example, when we hear about tragedies of someone being harmed or killed by a partner, and the majority of those involve a firearm. The other correlation is if you look at perpetrators of shootings, mass shootings, school shootings, if you look at the history, almost all of them have a history of domestic violence, even going back into their youth, teen dating violence, and animal abuse. That's a correlation as well, that animal abuse is also linked to domestic violence. So this is a community, a population, pregnancy and postpartum, that, I try to do outreach as the medical educator, try to do outreach to healthcare and wellness providers who are working around pregnancy and postpartum care, just so they're aware of this correlation, just so they can be talking to their patients and clients about this, and even just like having our materials and our resources, in their spaces and their offices to give to clients. The LGBTQ community is another community that we know experiences higher rates of intimate partner violence. So this is lesbian, gay, bisexual, transgender, queer individuals have higher rates of intimate partner violence. Their abusive partners often will use their gender identity or sexual orientation as part of the abuse, either as a put down, emotional abuse, or a threat to out them. And we also know that this community is less likely to ask for help or seek services, especially if they have had negative interactions with law enforcement, healthcare, social services around their gender identity or orientation. They're now not going to reach out if they need help because of intimate partner violence. I think this is kind of the argument for changing our name, is that it kind of changes the message, that abuse is wrong no matter who it's happening to, and anybody can come to us for services and be believed. We also know that men who are experiencing intimate partner violence are less likely to ask for help and seek services. And when they do, they often are not believed or get really negative messages, man up, be a man, or just like, this can't happen to you, especially if their partner is female, which is really damaging. So that, that sends the message, don't ask for help, don't talk about your problems. So, as an organization, we try again to raise awareness, and we try to get out the message again that anybody can come to us for services regardless of gender identity or sexual orientation. Intimate partner violence in later life. Yeah, I mentioned this earlier, that there can be an overlap. So for individuals 60 years old and older, any physical, financial, sexual, or emotional abuse of an older person from an intimate partner. And sometimes if their intimate partner is their caregiver, it can be both intimate partner violence and elder abuse. Elder abuse is really like an umbrella term that encompasses everything, including intimate partner violence later in life. So the intimate partner violence later in life is from a partner or a family member, where the elder abuse can be committed by anybody, but there often is that overlap. And we often are seeing, clients who fit that definition, who are 60 years and older and are experiencing abuse from a partner. There is an overlap between substance use and domestic violence. It's not an excuse for abusive behavior, but there is something called substance use coercion, where abusive partners will use substances as part of the abuse. I see a question in the chat. We have a few minutes left. Wow, time is running out. Yes, so I'm going to make sure we have time for this, for people to ask questions. So I mentioned earlier, survivors of domestic violence often will use substances to cope with the abuse. And then oftentimes their abusive partners sometimes will use that as part of the abuse to sabotage recovery, to out them, using it as a threat. The other thing I just want to share, I can put it in the chat, is our hotline number and our website are great resources. Again, you can call the hotline even just for general questions. So I'm going to put that in the chat so people have that. I'm going to X out of there. And then I'm going to open it up so we have time to ask questions. So any questions, comments, or topics that we didn't get to?
Yes, thank you, Rachele. If you can put any questions in the comments, or if you have any specific questions, if you want to raise a hand or whatever, we can unmute you. We have about 5 minutes left. And everything that Rachele had gone over in this presentation will be shared with all of our participants via email as a follow-up, as well as her PowerPoint and contact information for A Woman's Place and Rachele directly.
I'm happy to answer questions, or if anyone wants to share anything or any topics that I didn't cover that you want to make sure we talk about today. Great, thank you. I hope it was helpful. I'm putting in the chat now our website and my contact information. What is the best clinical intervention to use in a therapy session? So if you are seeing warning signs of abuse and you have the patient or client alone, you can just say that. You can just say, I'm seeing and hearing things that are worrying me, are concerning me. I'm worried that you're not safe in your relationship. Are you comfortable sharing more with me? And then just see what they say. In like the clinical settings, like when I go into healthcare providers and talk about screening, there's not necessarily a right or wrong way to ask the question. Sometimes they'll say, like, do you feel safe to go home today? Which could be appropriate, based on if they live with their partner. It could just, could be more direct, like, is your partner hurting you? It could be more open-ended, like, how do you and your partner resolve arguments and conflict? What happens when your partner gets angry at you? And also keeping in mind that even if you're screening, even if you're seeing the warning signs and you're asking about it and you're screening, or you're just using screening questions in general, denial is normal. They say it can take 5 or 6 attempts at being screened for domestic violence before someone is able to share. So, don't be surprised by that even if like every instinct is telling you this person is experiencing abuse and you screen and ask for it, they could be like, nope, I'm fine, everything's fine. If they do disclose abuse, whether you've screened or they just share that with you, I mean, all you really need to do is to let them know that there are services available. You can say like short, simple things like, this is not your fault. You're not alone. There is help available. There is an organization in our community that provides free comprehensive services, and then just give them our hotline number, give them our information. You don't have to be an expert in all things domestic violence. You don't have to be like a trauma therapist. All you really need to do is connect them to our information. In addition to these trainings, I do a lot of just like getting our educational materials out there. We have bathroom stall posters that you really can put them anywhere, but you put them on the back of the bathroom stall. There's little tear-offs. We're trying to get more like QR codes in our materials, because sometimes people are not comfortable sharing, even if someone asks them, but they might go in your bathroom and they might scan a QR code, or they might take that brochure or that little wallet card. So I'm happy just to even get our materials out there to you. I do a lot of like tabling events and health fairs. I am a part of a lot of like healthcare related committees and groups. So if you have any of those things, I'm happy to be a part of any of that.
Thank you so much, Rochelle.
Great.
And
Thank you.
the information was a lot and very informative. So I thank you so
Yeah,
much for that. If you want to, provide any brochures electronically to myself
I
and Mary
will.
Ellen, we
Mhm.
can just include them in our follow-up email to all of our participants and for our Wellness Wednesdays today.
I will. Yeah.